Ionotropic receptors. Uh, the receptors which are present on the cell surface, they are one GPCR family. Number second family is ionotropic receptor, yeah, ion channel receptors. These receptors are made of subunits which unite in such a way to form a pore, a channel, and the pore size is fixed, and this fixed diameter is increasing or decreasing by activation or deactivation of receptor channel. Such ionotropic receptors, they may be pentameric, like 5-HT3, nicotinic acid, glycine, GABA, tetrameric, AMPA, NMDA, trimeric, ATP, gated ion channel. Mechanism of nicotinic receptor, how nicotinic receptor open and close. This is the general structure of nicotinic receptor. This is made of alpha, gamma, beta, sigma, and after alpha subunit, there is acetylcholine binding site. This one acetylcholine binding site, and this is acetylcholine binding site. Now this is the general structure. Now how this acetylcholine it open and it closing. Remember, each subunit of this pentameric channel is further composed of 4 subunits, that is M1, M3, M4, M2. M1, M3 same. Among these 4, the M2 subunit is facing the lumen of the channel. So this is M2 receptor, M2 subunit, this is M2 subunit in this, and now this is M2. M2 subunit is further having 2 parts. One is bulky part, hydrophobic, and one is small, hydrophilic. When there is no acetylcholine binding and the receptor is closed, the channel is closed, in this closed form, this bulky hydrophilic is facing toward the lumen. But once there is acetylcholine binding with this channel, there is twisting in this M2. There is twisting in this M2 in such a way that this small hydrophilic phase is now toward the lumen, and this bulky hydrophobic is backside. So once this M2 is twist, all M2 will twist. This one, they will twist in such a way that this hydrophilic, small, they are now small hydrophilic, small. देखो भाई, after twisting these, once acetylcholine bind here, this chemical binding compelling this M2 subunits to twist in such a way that small hydrophilic of M2 subunit is now toward the lumen, and these small hydrophilic, they are negatively charged. So this is before acetylcholine binding, this is after acetylcholine binding. Before acetylcholine binding, listen again, the hydrophobic and bulky group of M2 subunit is facing toward the lumen. In this form, the channel is closed. But once these acetylcholine bind here, this chemical signal twists the M2 in such a way that small hydrophilic now facing the lumen, and all these are negatively charged, negative charge. This opening compelling compelling the sodium ion to internalize, that is the sodium influx. This is the nicotinic receptor. Acetylcholine bind, sodium influx will occur. This sodium influx shift the membrane potential toward more positive. Now this more positive new potential environment will open the calcium channel, and these channels are known as potential dependent calcium channel. When these potential dependent calcium channel open, there is increased calcium influx. When this increased calcium influx at the neuron cell membrane, there is syntaxin protein. These calcium bind at the ending of the syntaxin. When calcium bind here, there is repulsion and it open. When this receptor is open, this pocket of neurotransmitter along with other material is released in the synaptic. In the synapse, they are also releasing lysosome cutting this packet and releasing neurotransmitter will wake its receptor, and this is known as excitatory action. So nicotinic receptor are excitatory. Let's consider the GABA receptor. When GABA bind with this receptor, it opening the chloride channel which situated beside this channel. Once the chloride channel is open, chloride influx will occur. This chloride influx will change the membrane potential toward more negative. Now, for the opening of calcium channel need more positive environment, but this becomes the environment of cell more negative. So potential dependent calcium channel will not open. It's not open, calcium level decrease. When calcium level decrease, there is decreased release of neurotransmitter. The increased calcium, increased release of neurotransmitter. Now this is decreased calcium, decreased neurotransmitter, and this is known as activation. The action is inhibited. This is sleep, sedation, drowsiness. This is the mechanism of ion channel. Thank you for listening.